So when you first get your heart, what you'll notice is that the heart is completely encased. So recall that the heart exists within a pericardial sac. And so what we're actually seeing is the pericardial sac in place. Before you start cutting, you should look at some structures and you can find some things that are kind of cool. So this is part of the diaphragm that's still attached to the heart. And the heart itself, remember, the pericardium is actually attached to the diaphragm itself by the fibrous pericardium. And so what we're seeing here is the fibrous pericardium's attachment to part of the diaphragm of the heart itself. And then the outside of the pericardial sac is the fibrous pericardium. It's going to have quite a bit of adipose tissue associated with it as we're looking around here. Now when you look at the top of the heart, there's sometimes some tissue that can be found on that, although this is just coagulated blood. But occasionally we can find part of the thymus gland still attached to the heart up here. But I don't see it on this particular heart itself. So what we're going to do is we're going to take a pair of scissors and we're going to cut the pericardial cavity, pericardial sac. So we're just going to cut downward through the pericardial sac here. So what we did is we cut through the pericardial sac. What you'll notice is now we have actually a sac that surrounds the heart. And so the outside of this is called the fibrous pericardium. The inside, which is going to be a shiny surface, is the parietal pericardium. There's a space where pericardial fluid would be found, which is the pericardial cavity. And then as we pull this backwards, we'll see that the heart itself is covered by a nice shiny surface that we would call the visceral or epicardium. So just as kind of a review again, the heart exists within a pericardial sac. The outer part of the pericardial sac is the fibrous pericardium that attaches to the diaphragm and keeps the heart in place. As we pull the pericardial sac away, the space is the pericardial cavity. It would, in a person, contain a fluid we'd call pericardial fluid. And as we pull that sac away from the heart itself, we can see that the heart itself is covered by a shiny membrane that we would say is the visceral pericardium or the epicardium. Okay. So once you've cut your pericardial sac away from your heart, then one of the things you need to do is begin to get an orientation of the heart itself. So one of the ways to do that would be to look for major blood vessels. So this really thick-walled blood vessel at the top here is the thickest blood vessel wall that we'd find around the heart, which is the aorta. So one way you can do that is you can stick your finger in these blood vessels and see where your finger goes. And I'm going down here into the left side of the heart, so that confirms that this was the aorta. Now remember, on the model, just anterior to the aorta was another blood vessel that we see right here, which is the pulmonary trunk. And the pulmonary trunk comes off of the right side of the heart. And so once we find the aorta, the pulmonary trunk, then we can begin to organize our heart into left and right sides and anterior and posterior. So the pulmonary trunk tells us this is the anterior surface of the heart, and that this over here would be the posterior surface of the heart. And since this is the anterior surface of the heart and the pulmonary trunk arises from the right side, then that tells me that this is the right ventricle over here and the left ventricle over here. Now another trick for that is to recall that when we were talking, we said that the right ventricle myocardium is thin, the left ventricle myocardium is thick. So if I push on this side of the heart, there's very little give. When I push on this side of the heart, there's more give to it. So I know that this is my right ventricle over here. So if we can define our ventricles as right ventricle and left ventricle, then we can begin to understand the surface anatomy of the heart. This is an auricle, and so this would be the auricle of the left atrium on the left side. And we go over here and we should be able to see another auricle right here, which is the auricle of the right atrium on this side. So since we know this is right ventricle, left ventricle, then where all this fat exists is on that interventricular sulcus. and so are major blood vessels that we're seeing in the anterior interventricular sulcus. So we rotate it around, it communicates with the posterior interventricular sulcus. And the fat we're seeing going around this part of the heart here and around this part of the heart here is actually setting in that coronary sinus that we talked about that would have major blood vessels in it, or coronary sulcus, excuse me, that would have major blood vessels in it. So once we know that, then we've got a good orientation of our heart. So what you need to do then is to cut the heart, and we want to cut the heart down in this manner so that when we're cutting through the heart, we're going to separate the anterior view of the heart from the posterior view of the heart. So essentially what we want to do is a coronal or frontal plane on the heart itself. So what we've done is we've now cut the heart, and so before I continue, notice that there's this real fine tissue that we're seeing down here still keeping the heart together. That would be the surface material covering the heart, which is the epicardium that we can still see. I'm going to go ahead and cut through that so I can separate this into sides so that we can look at them. Okay, so what we want to do is we want to get an orientation of our heart again. So the myocardium is always thickest on the left side of the heart. The myocardium is always thinnest on the right side of the heart. So we can distinguish the right ventricle, this chamber here, because of how thin the heart wall is. And like when we were talking about the heart model, remember that the thinnest point in the myocardium is at the end of the right ventricle. So to prevent that from being overstretched, we have a band of muscle that runs right through the right ventricle. So what we can see here clearly is a moderator band, which is a real cool thing to be able to see. Now if we look at this side of the heart and we separate this out, then what we're seeing is the left ventricle over here. And you can see that the myocardium in the left ventricle is much thicker than the myocardium in the right ventricle. So we're going to clean this up just a little bit because I didn't quite get the section that I wanted because the heart was kind of at an angle. So when we move that away, we'll be able to see down into the ventricle really well. So remember, as we look down into the ventricle, we'll have ridges of myocardium that creates a three-dimensional pattern. These are the trabeculae carinae. Now the upper chambers are atria, so what we're seeing here is the left atria with its auricle. And then remember there's a valve that separates the left atrium from the left ventricle. So what we're seeing here is one of the flaps of the valve. So remember on the left side it's called a bicuspid valve because it's going to have two of these flaps. And then the flaps are connected to chordae tendineae. And the chordae tendineae are connected to papillary muscles. So we can actually see the papillary muscle here, the chordae tendineae, and the valve. And then we can see the epicardium of the heart here, the myocardium of the heart here, and then this shiny surface on the inside of the heart is the endocardium, so we can see the layers of the heart itself. So if I put my finger through here from the right side, then my finger now is in this blood vessel. So that confirms what we originally thought, which was that this was the pulmonary trunk, and it's the major vessel coming out of the right ventricle of the heart. So if we look over here on this side, then what we'll be able to see is that this is the right atrium that was leading to the right ventricle here. And if I cut through that, we're going to be able to see the valves again that connect those two. So I'm going to open this up for you so you'll be able to see it. And then as we were just talking about, here is a flap of a valve. Here's the chordae tendineae associated with that valve, papillary muscles, again, as we see the parts of the valve. Now sometimes what you can do, which is kind of cool, is when you're in the right atrium, you can actually find openings through which blood vessels were coming to and away from the right atrium. So this is the old superior vena cava that we're seeing right here that would have brought blood into the right atrium. If I follow that downward, I should be able to find another opening through which I can stick my finger. That's in the right atrium here. So this is my finger is right here sticking through the inferior vena cava, and I'm entering the superior vena cava right here. And both of those blood vessels are associated with the right atrium of the heart. Now, if I look at the left side of my heart, then I should be able to stick my finger through a blood vessel, and my finger will come out of this really big blood vessel that we had identified as the aorta of the heart. And so it's coming out of the left ventricle here, and what we're looking at is the ascending aorta, and they cut it where it would be the aortic arch, where it would have been connected as well. So sometimes what you can do is you can feel your pulmonary trunk here, you can feel your aorta, and you can actually feel the ridge of tissue right here. There's a ridge right here we can feel, which is our ligamentum arteriosum that we talked about, the remnant of the blood vessels that used to connect the pulmonary trunk to the aorta itself. Now what I'm going to do is I'm going to cut up through the aorta so that we can separate that tissue. So what we did is we just cut the aorta so we could pull it apart. So now we can pull the aorta apart where it's coming out of the left ventricle. And what we're going to see is right here is the flap of a valve. And so when we look at this, here's the flap of a valve that we can see. I'm going to stick my thumb in it here. And this flap of this valve is the aortic semilunar valve that we're seeing that we cut through here. Here's part of the flap, and then we would see more of it over here where it creates a little cup. So this little cup my thumb is in would fill with blood, and that causes that valve to close. And then the heart sounds that we hear clinically, lub dub, are created by the closing of valves and the turbulence on blood that's created by the closing of the valves. And so lub and dub are created by the closing of different sets of valves. So lub, the first one is the closing of the AV valves, like the bicuspid valve we're seeing here, and the tricuspid valve that we saw over here on this side. And then the second sound, dub, is the closing of the semilunar valves, the aortic semilunar valve that we were seeing down in here. And then if we looked at the pulmonary semilunar valve, we would see a valve that's over on the pulmonary trunk right in here that we could see as well. So just as a quick review, what we're seeing here is the right ventricle. We can see that the right ventricle is really thin here. The interventricular septum and the left ventricle over here. Remember on the right side, because it's so thin, we have a moderator van that prevents this from being blown out. At the top of the heart we have a left atrium with an auricle on this side, and then when we look at this side we would have a right atrium with an auricle on this side.